Poor appetite and unintentional weight loss are common experiences in patients with cancer as well as advanced organ illnesses. This is what I commonly hear from my patients. I'm just not hungry. Where did my appetite go? I'm looking at my favorite food, but I just don't feel like eating it. And it smells different. And from a patient's partner or family members, this is what I commonly hear. This is so frustrating. I'm making everything they used to like eating, but they just won't eat it. In this video, I will discuss some of the common causes of appetite loss in the setting of patients with cancer, as well as advanced organ illnesses. I also want you to better understand what is happening in the invisible process called the Anorexia-Cachexia Syndrome. What is it? And why does it result in poor appetite and weight loss? Let's talk about it. Welcome to Palliative Care Explained. My name is Dr. Jonathan Wong, and I'm a palliative care doctor based out of Winnipeg, Canada. Please see the welcome video of this channel for my declaration that I do not have any conflicts of interest or any financial sponsors, and for the medical legal disclaimer statements. The loss of appetite can have many causes. Sometimes the causes are more visible. There can be physical factors that can affect how comfortably a patient is able to eat. For example, a dry mouth or having ulcers inside of the mouth can make it difficult or painful to eat. And this is commonly seen in patients undergoing chemotherapy. How well our bowels or intestines are moving can also affect our appetites. For example, constipation from any number of causes can have a dramatic effect on our appetites. The experience of being sick can also alter how our brain interprets tastes and smells. And tasty foods previously enjoyed can become no longer appetizing. Certain smells, which may be benign to a healthy person, can trigger profound bouts of nausea and vomiting in patients who are ill. Sometimes even the memory of an event or the anticipation of a future event can trigger the sensation of nausea. And for most people, when they feel nauseated, they simply don't want to eat. Sometimes they don't even want to look at food. While on the topic of nausea, many cancers and organ illnesses themselves can produce and release their own chemicals or hormones that can directly cause nausea. And to make matters worse, many chemotherapies, treatments, and medications can directly result in the sensation of nausea, further decreasing one's appetite. Now, stepping back and looking at the broader picture, being sick is a draining process on the body and the mind. Worsening fatigue, decreasing physical function, changes in mood, these can all have dramatic effects on our appetite. And this is very challenging to treat. Where things get even more confusing are the scenarios in which patients do not seem to have any of the visible or typical causes of appetite loss, but they still do not have much of an appetite, and they're losing weight. So what's causing that? This leads us to further explore the invisible cause, the Anorexia-Cachexia Syndrome. This syndrome is commonly seen in patients with cancer, as well as in those with advanced organ illnesses. So what exactly is it? And how is it related to the loss of appetite and weight loss? Let's break down what these words mean. Let's first start with the word anorexia. This is defined as an involuntary reduction in one's appetite. The word cachexia can be defined as the unintentional loss of muscle mass and body fat. Another commonly used term is wasting. Now here's the important part. Cachexia is a complex metabolic process caused by the underlying illness itself and not just factors around it. So putting these two words together, you get a situation where the illness is the cause of loss of appetite and unintentional weight loss. And I want to really emphasize the word unintentional here. It is not the fault of the patient. It is not the fault of the person cooking the food. The weight loss is the result of having a serious medical illness. Now, if you are confused by this, you are not alone. The Anorexia-Cachexia Syndrome has been very poorly understood for a long time, and we still do not have a full understanding of how this process works. But we know more than we used to. So let's first talk about the anorexia part, the involuntary reduction of appetite. To better understand this part, we first need to know some basics of how the immune system works. So think of the last time you were infected by the common cold virus. Once your immune system recognizes this cold virus, it uses a very complicated chemical signaling system to tell infection-fighting cells what to do, where to go, and what to kill. Now, one important group of these signaling chemicals is called cytokines. And without these, our immune cells would not know where to go or what to do. The problem here, though, is that these cytokines and activated immune cells can also make us feel rotten, giving us symptoms such as fever, muscle aches, and loss of appetite. Now, there's likely some protective role here. Feeling rotten may force us to rest, save energy, and heal. And by limiting food intake, maybe our bodies are protecting us from the potential of nausea or an upset stomach. It's quite interesting how this all works. But fast forward now. The common cold virus is killed and eliminated, and these immune system cytokines and cells start to settle down. And in doing so, the fever goes away, the runny nose resolves, the muscle aches get better, and our appetite returns back to normal. What we have discovered is that in the setting of a patient living with a cancer or an advanced organ illness, a very similar process also occurs. Here, our bodies recognize that there's something wrong, or there's something foreign that shouldn't be there, such as a cancer. In an effort to get rid of it, our immune system releases and ramps up a very similar set of inflammation-inducing cytokines. As a result, patients experience similar fevers, malaise, and loss of appetite. The difference here is that these symptoms do not go away after a few days, like the case with the common cold. Instead, these symptoms have a tendency to remain and turn into a longer-term problem because the underlying illness is still there. This is one of the main reasons why patients don't feel like eating. To make matters worse, over time, this process can also act to reprogram our brain, as well as alter certain hormone pathways, resulting in persistent changes in how our body regulates the desire to eat. It is essentially making the reduced appetite the new normal. Let's now talk about the cachexia half of the Anorexia-Cachexia Syndrome. Why do we lose weight and lose muscle mass in the setting of an illness? Eating less can directly lead to weight loss, yes. But often, what we see is that the amount of weight loss and muscle wasting is greater than what the reduced appetite would cause on its own. This would suggest that there's more to this process than simply a reduced oral intake. When we are healthy, our body tissues, including our muscles, are in a constant balance of building up and breaking down. When we work out or go to the gym, we shift that balance towards building up. But in a patient with a serious illness, however, this balance shifts more towards breaking down. So why is that? Well, the presence of cancer, as well as other organ illnesses, can cause the immune system to release certain inflammation-inducing cytokines and other mediators. And these can directly cause muscles to break down. This sound familiar? Certain cancers can also produce their own chemicals that can directly cause fat to break down too. The additional problem is that these cytokines also shut off and inhibit the body's natural way of building these muscles back up. So what we see then is rapid unintentional weight loss that is greater than what we would have expected purely from a decreased appetite and low intake. Another area of cachexia-related research is looking at how our bodies become less able to extract and use nutrients found in food. This is an active area of study, and the exact mechanisms remain unclear. But from what we do know, there are several things happening at the same time. And this explains why there's ongoing weight loss, despite there being sufficient access to calories and nutrients. For the same reason, cachexia-related weight loss is not easily correctable or reversible, even if we supplement patients with lots and lots of calories and nutrients. This finding distinguishes cachexia from weight loss caused by starvation or nutritional deficiencies. Now, looking at the broader picture again, as part of a vicious cycle of the Anorexia-Cachexia Syndrome, many patients become more deconditioned from both fatigue as well as from the muscle loss from the cachexia process. This further worsens a person's desire to eat and further causes even more muscle loss. We see this commonly in non-cancer illnesses too, such as advanced congestive heart failure and respiratory illnesses such as COPD. To summarize this video, there are many causes of unintentional loss of appetite and weight loss in the setting of a serious illness. Some are visible and some are invisible. The Anorexia-Cachexia Syndrome is a complicated and invisible process, and multiple things are happening at the same time. The presence of inflammation-inducing cytokines made by our own immune system has a profound impact. It can turn off our sense of appetite, and it can have a direct effect on muscle loss and weight loss. This is a result of having a serious medical illness and is not the fault of the patient. The questions that naturally follow this discussion are, well, what can we do to improve the appetite? What can we do to put some weight back on? Can we actually reduce these inflammation-inducing cytokines? Stay tuned for follow-up videos on this topic. Thank you very much for watching this video.